I get a lot of inquiries and patients for the tear trough or the cheek area, and they all come with this complaint that they look tired all the time. And while there can be this appearance because of the skin changes, quite a lot of times it's because the volume has gone. And what has reduced is there are fat pads which are just underneath the eyelid muscles, called the SOOF fat pads. There is one in the medial aspect in this area, and then one on the side. And then, of course, there are cheek fat pads. So as we age, the bony platform is going back, and therefore you start seeing the appearance of this big valley developing over here. So changes in the bone, changes in the fat pad, all of these things contribute to the sunken look. So there are two ways to manage it. One is with a needle, and the other one is with a cannula. When we do it with a needle, the needle goes straight in, it goes deep, touches the bone, and you disperse the filler like so as little beads. And then we have to kind of progress along the bony rim and replace the SOOF fat pads and also the deeper cheek fat pads, right? So this is how a needle is used to volumize this area. The slightly better approach, and I can, even in the same patient, convert between the needle and the cannula. Go-to is always the cannula because the cannula is blunt and it's got a hole on the side. So if you come in closer, you can see that the cannula has got a hole on the side. So when the filler comes out, it is not coming at the end, it is coming from the side of it. The advantage of this is that the cannula pushes away the blood vessels and therefore is slightly safer and slightly less risk of bruising. The biggest advantage with the cannula is, unlike the needle where you had to go to 3 or 4 places, you just come from this angle over here, and then you go in there, and then you just lay the filler down on the rim while you're withdrawing the cannula, volumizing that area. So you can do this at various depths and build the volume up. When we volumize this area, it reduces the shadow that is being cast by the eye and the fat that is in the eyelids, and therefore it gives this nice smooth finish to this area. The lower eyelid looks like it's shorter, and generally it looks fresher and well rested. So if you have any questions about under eye fillers, dark circles under the eyes, do get in touch with me. I would be more than happy to